Alright, so before I go into the room, I'm checking the patient's chart. I see here that we have a doctor's order for albuterol every 4 hours. Alright, so I'm going to gather all my supplies. I've got my equipment right here. Alright, put my gloves on, wash my hands, grabbed a clean stethoscope, and wiped it off with an alcohol wipe. Okay, so I'm coming into the room now. Hello, Mr. Smith. How are you doing? I'm Kyle from Respiratory Therapy. I see here the doctor ordered an albuterol treatment for you. Before we do that, can I please get you to verify your name and date of birth, please? And I'm checking the ID band on the arm. Okay, Mr. Smith, thank you. So before we do this, I'm going to get a set of vitals on you. Okay, so I'm checking the radial pulse, holding for 30 seconds, and going to multiply by 2. Okay. See, the patient has a heartbeat of 80. Alright, while I was getting the heart rate, I was watching chest rise and fall for about 12 breaths per minute. Alright, I'm going to get some breath sounds from our patient. Put my stethoscope on.
So you ready?
I'm auscultating the lungs. 6 places on the front and 6 places on the back.
John, I just want you to. I didn't look at that. Except when I want something.
Alright, blood pressure cuff on the monitor shows that he's got a blood pressure of 120 over 80. Alright, and I put an SpO2 monitor on his finger and got an SpO2 of 98%. Okay. So, Mr. Smith, like I said, the doctor's giving you an albuterol treatment. So what we're going to do is we're going to set the equipment up, use the medication. Have you received an albuterol treatment before?
Yeah.
Patient states that he has. Okay, Mr. Smith. So it's going to be the same process. We're going to give you the treatment it's going to take about 8 minutes, and you should be feeling better afterwards. So I come over to the table. I grab my equipment. I'm going to set up my equipment.
No, I'm just gonna. Do you want me to be a certified emergency room technician?
Okay.
I'd be like this. Sorry, sir, I'm your nurse. I need to put in a catheter right now.
Hook the O2 tubing up. I'm going to run it at 8 liters. Should last about 8 minutes.
So how do we send this thing?
Alright. Mr. Smith is going to receive the treatment. Alright. Alright. Treatment was given for 8 minutes.
No, I just pretended I was on a computer.
After treatment was delivered, I'm going to recheck the vitals. While he was receiving the treatment, I was watching the monitor to make sure he didn't get a spike in heart rate. Okay, I'm manually checking the radial pulse again. Patient still has a heartbeat of 80. I'm going to listen to the lungs. Again, 6 places on the front, 6 on the back.
And then I download it to the email and I send it to them.
Okay. And then I'm going to ask the patient if they can cough, see if they can mobilize secretions any better. Mr. Smith, can I please have you cough? Patient demonstrated that he could in fact cough. Alright. And I'm going to explain a little bit more to Mr. Smith. Mr. Smith, like I said, so we gave you the albuterol treatment, and we're going to continue giving it to you every 4 hours. And I asked the patient if he has any more questions. The patient says he does not have any more questions. I clean up my equipment. Mr. Smith, is there anything else I can do for you before I leave?
Not a bad one.
Mr. Smith says no.
Get in there.
All right, Mr. Smith, have a great day. Let me know if you need anything later.